Hello, everybody. Hi, 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 hi. It's good to be back here again. So we celebrated the World Pharmacy Day, and I put up a post on Facebook, and I saw people respond. I am so grateful. Thank you for appreciating us. But as of yesterday, and even before then, I saw a need to put this out here and let people know exactly what it is that pharmacists do. I know that a lot of people have misconceptions of who a pharmacist is. Some people just think that the pharmacist is just there to just be giving you drug. When they read the doctor's prescription, they just give it to you and then you go to your house. No, if you are still in that space, I came to tell you people that you need to evolve. Like, you need to leave that site and come to where we are now. Pharmacy has evolved beyond just the dispensing of drugs. So as we celebrated the World Pharmacy Day, the theme was to unite in action for a healthier world. Yeah. So we have pharmacists in different areas of practice, not just in the community pharmacists. So I'm going to be highlighting and exactly what they do. We have pharmaceutical scientists, the ones we know as industrial pharmacists in Nigeria. And what they do is they're involved in research. For example, when the COVID thing came, those people were in the labs, looking for a solution, looking for how to come up with vaccines that could actually treat it. So not just vaccines, but also the drugs that you swallow, the syrups that you give to your children. These people are so involved researching to ensure that they produce good medicines for the treatment of illnesses, diseases, and whether they are communicable disease or non-communicable, but those people are there in the lab researching day and night to ensure that good medicines get to you. And so it looks as if they're not doing anything because they really do not project them. But this is what today's video is about, to let you know what they're actually doing behind the scenes. Okay, so that is that for industrial pharmacists. We also have those in the academia, those that teach, pharmacists that teach, pharmacists that pass knowledge on to the younger ones, those that trained us, and those people, they impart knowledge. They also do a lot of research to just ensure that we have the best professionals out here to meet your needs, and so they're also working very hard, and I don't think they get appreciated enough. I want to appreciate my lecturers, I want to appreciate my teachers, those that were involved one way or the other, not just in the university, all of them that taught me one thing or the other, that impacted my life and got me to this point to become a better pharmacist as the day goes by. Thank you so much. We appreciate you. For the pharmacists in the academia, you're doing well. Thank you so much. You're the reason why we are here today, aside from God. So we also want to say a very big thank you to the industrial pharmacists or the pharmaceutical scientists that put in the work to get these drugs out there. Thank you so much. So the last one I'm going to be talking about is the clinical pharmacists, those that work in the hospital, those that work in the community pharmacies, those that work in the public health industry. There are even pharmacists that are tech pharmacists, like they're involved in everything technology. So pharmacy has evolved. It's beyond just going to the hospital to see somebody counting drugs and giving you. No. Pharmacists are growing, pharmacists are becoming better, they're contributing to their world, whether in technology, in the hospitals. So they don't just give you your drugs in the hospitals, right? They check to see if what the doctor has written will be suitable for you, and also discuss with the doctor for a change if need be. So there are sometimes that the drugs, like you can have like 5 different drugs to take. Maybe you're treating an ailment, and then the pharmacist says that, this would interact with this and may not be good for the patient. Quickly call the doctor's attention to it. Or maybe a client is having an issue, they can easily trace it. If it is as a result of the drug that they're taking, they can easily trace it and then help that person. And so we also have those people, not just people that teach in in schools, but there's some people that have platforms, where they give out useful information on how you can take your drug, on how you can be better while you're on your drug. All those people are contributing positively to making the world a healthier place. So all of those pharmacists in different practice, they all come together, they unite to ensure that safe medicines are out there, to ensure that even while you're on your medicines, right, that you are safe while you're taking them, you're not dying instead of the medicine to be doing what's supposed to be doing, and all of that. So they are contributing one way or the other. You may not necessarily see them. I know that a lot of people talk about their doctors, a lot of people talk about their nurses, but the pharmacists, they play a vital role in healthcare, and I'm here to appreciate every one pharmacist out there. Wherever you're working, no matter how small the place is, keep on contributing your quota. It may not be recognized, but stay in purpose. Keep doing what you do best. Rewards always come one way or the other. Even if nobody recognizes you, right? You're not doing it for recognition. You're doing it because I see pharmacy as a calling for me, right? You're doing it because you're called to serve. So even when I'm in places and people feel like, your own is too much, I just feel like you don't understand it. So you've gotten the knowledge, you've been taught, you know what to do. You're still learning as you attend to people, as you service the needs of others. So keep on doing your best. All right, there's a blessing for whoever is diligent. You will surely stand before kings. And so that's my message today. I hope that people who are not pharmacists now know what we do as pharmacists. And if you really want to know more, then let me know in the comment section. Thank you so much for listening. I hope I've not confused anybody. I hope I've been able to, say it in simple ways where how you can understand. So whatever you're doing as you see this video, you have a pharmacist friend that you call any time of the night, any time of the day, and they respond without asking you for consultation fees. Haba. Yes, you can do to appreciate them. I know I've been opportune. God has privileged me to help some people, and they don't even remember. I'm the one that will not check on them and I say, how far are you now? Okay. I do not say I'm fine, no, but I don't take it to heart. I'm just happy that I can, affect people's lives positively. So in whatever you're doing, in fact, I just got back from work, so I just decided to put this out there. It's fun being a pharmacist. It's not always it's not every day that it's good, because most times we don't get recognized. Our work is not something that makes us to be seen by patients, but I'm still proud to be a pharmacist, and I celebrate everybody worldwide. Let me stop talking and just end this video right here. So it's World Pharmacy Day, and I celebrate every pharmacist. Thank you also to the clients, the patients that reach out to us. You're the reason why we do what we do, and we look forward to serving you better. Do have a lovely, lovely, lovely day. Thank you for listening, and if you're a new subscriber, wow, it's good to have you on this beautiful channel. If you're a returning subscriber, thank you so much for the support. And if you're just seeing my video for the first time, my name is Matilda Samuel. I'm a pharmacist and I work in the public health sector. I also put out useful information to ensure that you take your drugs the right way and you stay safe while on it. So please hit that bell button, subscribe before you leave here, like this video, share to others, and also help to pass the information across. Pharmacy is beyond dispensing. Bye.